Okay. For the module 2, we have the methods of collecting data. So, in this module, you'll be able to differentiate different methods of collecting research data. Okay, so we have the use of existing data, use of observers' data, self-recording or reporting, or Delphi technique, and critical incident technique. So the use of existing or available data, researchers may collect information from reports and documents that already exist within an institution. So the module identifies two general forms of existing or available data. They can be raw data from basic documents, or tabular or summarized data. The raw data are original. Amo ni mga original unprocessed entries. No, for example, individual admission records, patient's birth dates, discharge dates, medication records, laboratory results, nurses' notes, incidence reports, daily census sheets. So these are raw data. So researchers want to determine the average length of hospitalization among patients with pneumonia, let's say. So they will get information like admission date, discharge date, diagnosis, age, and treatment received. So these are raw data because the researchers still need to organize and analyze the individual entries. Let's say Abby, may arabi 50 nga ginakuhaan sang raw data. So raw na siya pag hindi pa siya ma-process. Kay ang isa-isa sina, let's say respondent 1 ano ya data, respondent 2 ano ya data. Okay, they are raw data kay wala pa siya ma-process into entries. Okay, and then tabular data have already been counted, summarized, or arranged. So once na halin na sa raw data, gin-gather mo na tanan 50 abi atong yambal ko, then itabulate siya. Tabular data have already been computed, di ba? Na-compute mo na siya, i-summarize mo na siya, or i-arrange from the raw data. So example, abisang aton nga tabulated nga data, monthly number of admissions. So tanan to nga admissions, tipunon mo to sa month of July. So tanan nga admission sa month of July, tipunon mo to siya, ang tanang nga raw data, and then itabulate mo siya nga amo na ang monthly nga na-summarize mo or na-arrange. Okay, so matabulate mo na siya. And then let's say sa annual, number of deliveries, number of surgeries, pwede mo na siya matabulate. Basta mayara ka na sang natipon mo na yung raw nga data. Okay, so hindi ka man katabulate kung wala ka sang raw nga data. Ano itabulate mo? Tama na. Okay, use of observers data. So observation involves the actual watching and recording of behaviors, activities, conditions, or events. So ang nursing research, let's say tabi example, so hand hygiene practices. So you observe, let's say, proper use of personal protective equipment, nurse-patient communication, So the use of observers data, these are observation involves the actual watching and recording of behaviors, activities, conditions, or events. Okay. Then we have types of observers under the observers data. We have the non-participant observer. So a non-participant observer observes the group but does not take part in its activities. For example, a trained research assistant nagalantaw lang watches nursing students perform wound care but does not participate in the procedure. So the observer may focus on recording whether each step is correctly performed. Ano naman ang overt non-participant observer? So identifies himself or herself, explain the research role, informs participants that observation will occur, and does not join the activity. So, ara lang siya as a researcher, introduces herself toward nurse, let's say, and informs them that she will observe. Nag-inform siya nga ma-observe sa bisang hygiene compliance. Ano naman ang covert non-participant observer? So, ang observer nga ni does not participate, does not reveal the research role, observe participants without their knowledge. Okay? So, a researcher secretly watches, okay, there's a word, secretly watches nurses, medication administration practices without informing them. That's an example. So, wala siya nag-inform, basta ara lang siya nag-observe. Okay. So, although covert observation may reduce changes in behavior, it creates, concerns involving privacy. Amo ni mga issues niya with a covert non-participant observer. Informed consent, wala. Deception, participant rights, di ba? So, ini siya, do matawag tani nga, hindi siya masyado gina-practice. Let's say, kung dapat siya i-practice, damo ini paguro na agyan. But, without the consent, mulubudlay ini magkuha sang amo ni nga klase nga data. Okay, which is the covert non-participant observer. Okay, ano naman ang participant observer? So ang participant observer ni class, amo ni siya ang belongs to or joins the environment being studied. So the observer shares the same setting sa participants. So example, Abby, ang staff nurse working in the ICU also observes communication patterns among members of the ICU team. So in ang observer ni, maintindihan niya ang group culture, common routines, unspoken practices, meaning behind behaviors. Ang limitation ng sini is the observer may become too involved and lose objectivity. Siyempre maka-build siya bisang familiarity, let's say, So, ang participant observer is involvement siya sa iya gina-observeran. Okay. Overt participant observer. Ano ang overt? Let's say, participate siya in the setting, reveals in research role, has the participant's knowledge and awareness. Okay. And then the covert, participants in the activity, does not disclose the research, and pariman to sa covert nga wala siya sa naga-reveal, nga siya naga-observe. Okay, so let's say observer, overt non-participant, ga-participate siya, wala. Covert non-participant, ga-participate siya, wala. Ang overt participant, yes, nag-participate siya sa being observed. Covert participant, yes, ga-participate. So, does the participants know? So, sa overt, naga-participate siya, kagkabalo siya, nga observeran siya. As a covert participant, siya sa being observed, pero wala siya kabalo. Amo nang kinalain nila. Okay? Ano naman ang kinalain sang overt non-participant kag covert non-participant? Ang overt non-participant, wala siya participate pero balaan niya. Ang covert non-participant, wala siya ga-participate pero wala man siya nakabalo. So basically ma-determine mo ang covert. Kaya ang covert class wala giniya kabalo ang participants nga the participants participants are being observed. So medyo niya siya, tagilid niya siya sa ethics. Okay? Kaya wala sang informed consent sa covert participant. Okay? Two methods of observation. So we have structured observation. So this is still under our objective sa observer's data. Two methods of observation. The structured observation. Ang structured observation is used when the researcher already knows the specific behavior or event to be observed. Kabalo na sila kung ano ang ila i-observe. Okay? So, mayara sila sang checklist, mayara sila sang rating scale, may observation guide sila. Okay? So, and then, the unstructured naman niya, the researcher observes and describes what happens without using a predetermined list or expected behaviors. So, for example, Abby, ang researcher spends time in an emergency department and writes detailed notes about, let's say, staff communication, patient movement. So, ano nga tong comparison diri, no, sa structured kag sa unstructured nga observation? Sa structured, mayara siya nga predetermined behaviors nga dapat siya i-observe, no? Mayara na siya yung goal, amo ni observe ko, and then usually gamit sila sa checklist, tapos mas hapos i-count kag mas focus siya kay kabalo siya kung ano ang i-observe, and then useful siya kung ano sa iya nga topic, sa iya nga research, kay mas kumbaga nakalinya, naka-align. Sa unstructured naman, wala sang fix nga kung ano nga behavior i-observe niya. And then, usually, gagamit lang siya sa mga narrative notes kung ano lang gid ang i-observe, tapos ma-produce ang detailed nga mga description. So, this is more exploratory, ga-explore siya. And then, useful ini kay makita niya yung mga unknown. Okay? Unlike sa structured, makita ilang kung ano lang gid ang ara sa listahan niya, ano lang gid ara sa goal niya. Sa unstructured, useful iniya nga wala siya sang mga specifics, because ang mga areas to pwede niya makita, which is nga useful katama man kung unstructured, kay may iban ka pa nga makita nga or ma-observe nga unknown events, let's say, or practices. Okay. And then we have the self-recording and reporting approach. So sa examples ng self-reporting, we have the questionnaire, interview schedule. So amo ni mga methods na ginagamit to allow participants to report information about themselves. So let's say, Abby, examples of self-reporting instruments: questionnaire, interview schedule, symptom diary, sleep log, pain record, di ba? And then, ang ano lang yan ang sinisang self-reporting is, ang self-recording, ang limitation is malipatan, forget information, na misunderstand ang questions, no? Give socially acceptable answers, parang let's say, Abi, mula ni sabat ko para okay, no? Tapos skip yung mga sensitive na questions, and then pwede niya or i-exaggerate niya man, no? And then ang advantage lang dire sa self-reporting, kung ka-collect ka as a nurse na researcher, yung experiences na that cannot be directly observed. Ano, Abi, na ang pain, ang fear, satisfaction, anxiety. So ang self-recording, sila mismo yung makabalo, ang patient mismo ang makarecord sang iya nga pain, fear, kung ano daang iya nga nabatyagan. Okay, nga which mga experiences hindi directly observe. Okay, quality of life, perceptions, attitudes, diba? So nursing example, let's say patients with diabetes, diba? So complete a daily record containing blood glucose level, food intake, exercise duration, medication intake, symptoms experience. Okay. Alright, so Delphi technique. Ang Delphi technique obtains the opinions of judgments or experts through a series of questionnaires or structured rounds. So ang goal there is usually to develop consensus. So experts do not always need to meet face to face. their responses may be summarized and returned to the panel for further evaluation. Meaning to say, nagakuha siya sa opinions or judgments from experts, no? Let's say amo na siya ang, let's say abi ang process is round 1, ang experts malist siya sang important competencies, no? Let's say mga experts na mga panels na siya. And then sa round 2, mga researchers mag-combine sila ng similar answers and ask experts to rate each competency. Ipasa naman sa isa. And then round 3, so experts reveal the group ratings and reconsider responses. And then they'll finally come out with a list of competencies with the highest agreement kung ano ang ilang nga magiging result sa imo nga ginstudihan. Okay, so basically it is from the opinions or judgments ng mga experts nakuha mo. Okay, and then of course we have the under sa Delphi technique, we have the classic Delphi. So questions are presented to inform individuals or experts in a particular field. Sa modified naman niya, interviews or focus groups may be used before or together with questionnaire rounds. Sa Policy Delphi explores different arguments, opinions, and possible consequences related to a policy issue. Okay, and then the real-time Delphi, amo ni siya mga responses and feedback nga are processed within a structured or shortened period. Okay, so you go through with the module, kay limited lang mani ang ako na oras, so module 2 pa lang kita. So malumpat kita sa critical incident technique. The critical incident technique collects information about actual events, behaviors that had a particularly important positive or negative effect. Okay, for example, describe a situation in which communication between a nurse and a physician prevented harm to a patient. And then another, let's say, describe an incident in which a breakdown in endorsement affected patient care. Okay, so there's a critical incident technique collects information about actual events or behaviors that had a particularly important positive and or negative effect. Okay, then we have the coding and code book. So sa module nga discussion, ang critical incident technique is followed by an explanation of coding and the preparation of a code book. So coding means assigning numerical symbols or labels to collected information so that the data can be organized and entered into the computer. So let's say ang code book may include variable names, variable definitions, numerical codes, response categories, copies of scales, questionnaires, data collection. So, the module nagatag sa aton sa example sang coding, no? Let's say sa line sang variable miyara kita sang sex. So ang miyara sang meaning male, female, and then ano na siya nga code. Kung sex ang male is code 1, ang female is code 2. Ang sa civil status kung single siya, code 1. Tapos sa married code 2 nan. Gamon siya. Do code book siya kung ano nga code ang certain variable. Okay, now let's move to module 3. These are the measurement of variables. So we'll be able to learn the meaning of variable, meaning of measurement, advantages of measurement, and levels of measurement. So ang meaning ng variable, ang variable class is a quality property, condition, or characteristics that can be changed or differ among persons, objects, groups, or situation. So, ano abi, let's say abi ang usual tanga mga variables: age, weight, blood pressure, pain intensity, okay, anxiety, knowledge, and so on. No, let's say medical adherence, number of hospital admissions. So, amo na bi ang mga variables na may ang nakita naton as property to be studied. Okay? So, then we have the, let's say, example, relationship between nurses' workload and quality of patient care. So, ano ang maging possible na variables diri? Ano makita nyo? Of course, nurses' workload kag quality of patient care. So, amo ni siyang i-measure nyo. Kay amo na ang nakita nyo nga particulars, nga variable, nga dapat nyo i-measure. Okay? And then, we have the meaning of measurement. So, measurement is the process of assigning numbers or values to represent the amount, category, rank of level, and attitude. Let's say, abi, ang aton nga variable, nurses workload. So, paano ta na siya ma-measure? So, ma-assign kita sang values to represent the amount sang workload. Okay? Which will be gathered using data gathering naton. Okay? Then, the advantages of measurement. Ano ang advantages ng measurement? It reduces subjectivity and guesswork. Wala ka nagapakot-pakot because the numbers are there. Diba? Nag-gather ka sang data, sang base sa imo variable, and then, gin-measure mo. Okay? So, wala ka gapakot-pakot because you are measuring the data. Okay? Then, we have the levels of measurement. We have the nominal, ordinal, interval, and ratio. Ang nominal ni class, amo ni sila ang mga may mga classify people, objects, responses, no? So, let's say abi sa category nga have names or labels. Let's say be sex, blood type, religion, civil status. These are nominal, okay? And then, ang ordinal naman niya, classify sila, ang mga observation mo na classify into categories that can be marank mo. Okay? So, mild, moderate, severe, poor, fair, good, very good, excellent. So, these are ordinal level. And then, we have the scales and ordinal measurement. We have the Likert scale. Diba? Sa Likert scale, usually, ang format naton, ang format is, let's say, strongly agree is equivalent to 5. Agree is 4. Undecided is 3. Disagree 2. And strongly disagree is 1. So, amo na class. So, I mean, damo gagamit sang Likert scale because mas easy sa statistics nga basahon. Or I mean, kwaon, no, ang result. And then, the module, nag-describe as well sang Likert scale nga ang iya nga declarative items sang participants, no, ang degree of agreement kag disagreement. Amo na iban nga gamit sang Likert scale to measure the degree of agreement and disagreement. Okay. So, we have also the semantic differential scale. Ang semantic differential scale nag-ask respondents to rate a concept between two opposite or bipolar objects. No, for example, please rate the hospital's nursing service. Unhelpful, 1, 2, 3, 4, 5, 6 to helpful. So, ang highest, be help, 7. Unfriendly, rate mo siya 1 to 7. So, ang lowest is 1. Ang highest is 7, no? Going to friendly. So, unfriendly to friendly. Doon mo na bila. So, the respondent places or mark at the point that best represents the perception. So, ang perception na biya unhelpful sa mga staff. Tapos, miyara da nga 1, 2, 3, 4, 5, 6, 7. So, dara i-mark da kung di ka 2 ka lang for being helpful. So, kung lang tao mo na siya, ang 2 nubo siya, no? Kaya ang tunga-tunga ara sa 4. Okay? So, let's say, mera pagid, Q-sort. Sa Q-sort, participants are given cards containing statements, words, or phrases. So, they arrange the cards along a bipolar dimension such as most important or less important, no, strongly agree to strongly disagree, pero ang pag-arrange ni, let's say the nurses arrange statements about workplace motivation from most important to me to less important to me. So, let's say ang statement may include salary, professional growth, recognition, supportive management, work-life balance, patient appreciation. So, ang Q-sort are given cards containing statements, words, or phrases. Okay. Then, we have the visual analog scale. Ang visual analog scale measures subjective experiences along continuous line. Okay. So, pain, ma-measure kita, abi. 0 to 100. Worst imaginable mo, abi. Okay, the pain is like 70. Okay? So, ang advantage yun it may be easy to complete, sensitive to small changes, appropriate for subjective symptoms. Kasi syempre, subjective siya. Kaya siya ang nag-measure sang pain niya mismo. Kung ano yan na batyagan niya, ba siya. Ang degrees ang pain, kung ma-measure ta pa lang siya, sa lain-lain siya nga tao matupa, lain niya ang subjective nga mabatyagan sang person 1 kag ni person 2. So, ang symptoms nga nabatyagan sa pain is subjective, no? Okay? And then we have the graphic rate scale. So, ang graphic rating scale asks respondents to rate a concept along an ordered numerical continuum. Okay, so rate the effectiveness of discharge teaching. Very ineffective, very effective. 1, 2, 3, 4, 5, 6. Okay? And then we have the interval level. Ano naman interval level? Example, the difference between 36 degrees Celsius and 37 degrees Celsius is the same as difference between 38 degrees Celsius and 39 degrees Celsius. So, however, ang 0 degrees Celsius does not mean that the temperature is completely absent. So, therefore, ang Celsius ng temperature has no absolute zero. So, ang important point ni class is because 0 is arbitrary. So, it is not meaningful to say that 40 degrees Celsius twice as hot as 20 degrees Celsius. Okay? Then, we have ratio level. Ang ratio level naman niya, miyara kita order, equal intervals, at true absolute zero. Okay? We have the true zero. At true zero means complete absence of the quantity. Wala gid. Zero means no. Wala gid. None. Alright. Then, we move to Module 4. So, medyo overtime na ako. I'm sorry. Class ha. Okay, hindi ko ma-move ang akon nga slide. I don't know why. Ay, wala na. Okay. Sa Module 4, sources of measurement errors. So, ang aton module, ma-identify siya sang 7 sources: environmental contaminants, variation in personal factors, quality of responses, variation in data collection, and clarity of the instrument, sampling of items, format of the instrument. Okay, some measurement error occurs. Di na siya nag-occur ang measurement error. So when the value produced by a research instrument differs from the actual or true condition being measured. So why nga ka-error? Let's say, Abe, a patient's actual blood pressure is 130/90, but the instrument records 150/90. So, no? So, there's a difference between the actual condition kag sa na-record na value represents measurement error. It could be the patient was not allowed to rest, the device was not calibrated, the data collector used the wrong procedure. So, amo na mga measurement error that could happen. And then, major sources of measurement error. Amo nang 7, no? And then, we have the environmental. Let's say, Abe, environmental, pag ano mo sang data, pagkuha mo, no? Pag-test mo, environmental contaminants are features that of setting that influence participants' response nga mapektuhan siya sa responses siya because of the environment. Let's say, sa temperature, sa lighting, sa time, sa friendliness ng researcher, sa presence of observers, sa research location. No? Example, ang pasyente Abi nag-answer sang satisfaction questionnaire. So, while the nurse who cared for them is standing nearby. So, they maybe provide sang favorable nga answer. Because ara, ang ginarate yes for the satisfaction, ara lang sa tupad ya. Okay, so there's an error. Okay. So, another, patients do nag-answer sa bisang kalaba nga questionnaire. So, laba na dan ng questionnaire, mainit pa, poorly ventilated, no, ara sa waiting area. So, instead nga basahon, check na lang. So, those are the errors. And then, we have the variation and personal factors. Let's say, Abi, kung kapoy siya, nagutom siya, wala siya sa mood, so that will affect the gathering. Okay? And then, clarity of the instrument, hindi siya kaintindi. Okay? Variation of in personal factors, amutog yung hambal ko, sampling of items. Okay. So, measurement error may occur when data collector use different procedures sa variation data collection, no? Like, instruction, hindi sa kaya kaintindi maayo, no? So, medyo mabudla yan. Let's say, 6 ka nursing students nag-distribute sang the same na questionnaire. Si Research A nag-explain sang every question. Si Researcher B does not explain anything. Si Researcher C nag-influence participant by suggesting answers. So, there are variations nga. Depende bala kung paano distribute yung mga questionnaires together with the instructions. Okay. And then, we have the clarity of the instrument. For example, poorly worded questions may be interpreted differently by participants. Okay? Like example, do you regularly take your medication properly? So, ang problema dire, what does regularly mean? What does properly mean? So, does it refer to correct time, correct dose, or both? Okay, so dapat i-improve yung version. Paano i-improve? Let's say, during the past 7 days, on how many days did you take all prescribed doses for your medication? Okay? So, dapat, yung clarity sa question, hindi siya poor-worded, hindi siya confusing, no? Para nga ma-answeran sang tsakto. And then, sampling of items. So, amo ni siya ang measurement instrument contains only a sample of all possible questions that could represent a concept. So, ang error there may occur when the selected items do not adequately represent the variable. Okay? Let's say, nursing research example naton. A questionnaire claims to measure patient satisfaction but contains questions only about room cleanliness. Okay? So, miyara na siya sang error dira. Patient satisfaction may also involve communication, responsiveness, respect, pero naka-focus yun siya sa cleanliness. So, kumbaga, ang makuha mo lang nga data was the cleanliness. Okay? Because it could, gather other items like communication, responsiveness, respect. Okay, and then we have the format of the instrument. The physical and technical presentation of an instrument can influence responses. So, like for example, open-ended questions, participants answering using their own words. What difficulties did you experience after hospital discharge? Let's say, amo na B. Okay? So, ang advantage diri, makaproduce sang detalye. Ang disadvantage naman, it requires more time to answer and analyze. Sa close-ended question naman, participants select from predetermined choices. Miyara na sa sang choices. Okay? Ang oral versus written administration naman, nga format ng instrument, participants may answer differently when speaking directly with an interviewer or completing a paper questionnaire using an online form, answering by telephone. So, and then we have the order of questions. Earlier questions may influence later responses. Okay, so that is amo na tanan class. That is all. And kung isa-isahon mo gito tanan sa module, no, studihan nyo lang gid kay I know nga easy lang gid ni ang module 1 to 4. Ang hibalon dapat nyo lang gid ma-determine yung mga differences nila because sa mga terminologies nga ginagamit diri. Okay? So, ma-move kita sa module 5.